Okay, Jack, you have a lady next to you.
Okay, this question is for Sharon. Hi, Sharon. Um, I have a question related to patients that are getting infusion. We don't see a lot of myeloma patients upstairs. So my question is, I guess generally for cancer patients that have other comorbidities, i.e. diabetes, how do you work with those patients in, like if they are getting chemotherapy because we use steroids and that ups their blood sugar, how do you work with them in relation to their diet?
How do we at Cancer Treatment Centers of America?
Well, or as a dietitian, period.
Well, it depends. At Cancer Treatment Centers of America, every patient works with a dietitian and is on the team of a medical oncologist. So every
Right.
time they come in.
Right.
So if you're at a facility, ask your medical oncologist. Tell them that you need to meet with a registered dietitian. Feel empowered. This is about you. This is your treatment. And so many patients tell me that they just don't feel empowered. They feel like things are happening to them. Their treatment plan is decided for them. Feel empowered. Let your medical oncologist know what you need and what you would like to achieve from your treatments. And if you feel like your blood sugars aren't controlled and you need to meet with a dietitian to go through your plan, if you think that weight loss might be appropriate or you want to discuss that with a dietitian, let your medical oncologist know and he can write you a prescription for that consult.
If you allow me a second for a comment, I'm Steve Milliner, both a physician and a patient. I think I speak for everyone in thanking Jack and Barbara for their continued and remarkable efforts to provide us this conference on an annual basis. I've attended each one and congratulate you on its passage from strength to strength. So thanks. My question, actually I have three if you don't mind. First question is for Dr. Adu. In the use of Velcade, in a patient in whom Velcade resulted in no identifiable disease but caused a neuropathy, and rather significant neuropathy, would you advise use when that disease became resistant to some other form of treatment?
It's a difficult question. I think when Velcade first became available, we didn't know as much about it as we do now. We saw a lot more patients then where the early stages of neuropathy were not picked up and they went on to progress to painful, severe, debilitating neuropathy. We see that less now, and I think we've recognized that if you pick up the early stages and do the appropriate dose reductions, you can avoid the more severe cases more of the time. Everyone is reluctant to go back to a drug that caused side effects before, and so it has to be a risk-benefit consideration. But I think if one does decide to go back to a drug like that, one would have to be very careful and try to pick up the very earliest stages. One of the more positive observations in the Velcade, in the bortezomib series of treatments, is that patients who had to have dose reductions because of neuropathy did not necessarily lose the therapeutic benefit. So in that one study, they did just as well as far as disease outcomes as those who stayed on the higher doses.
Thank you. That's very useful. Is Dr. Finley here? Judith? Different panel? Okay. I'll hold that question for later. The next question is really in reference to the Multiple Myeloma Research Federation webpage. Changed about 6 months ago. And previously you automatically linked to their clinical trials and the abstracts of the various medications. That seems to be gone. Can you direct us to where? Because I found that very useful information. Is anybody here aware of where that information is now found?
I don't think this panel can answer that question. Okay, we're going to go to the center of the room.
My question is there any support groups out there for, young children when their parents are stricken with this, you know, like 10, 11-year-olds or something that really need some emotional help?
Yes, there are two programs that I'm familiar with for children whose parents have cancer. One is the Klein program at Banner Desert, and Patricia DeBruhl is the facilitator of that group. It's a time-limited 6-week program for children whose parents have cancer, and I think it's offered about twice a year. The other one I'm very familiar with, and that's called Kids Can Cope, and that's an ongoing support group at Banner Thunderbird for children from ages 6 to 16. We meet twice a month, and the purpose of it is for them to meet other children who are going through the same thing so they don't feel alone. We also really focus on them learning a little bit about cancer and treatment and providing a place where they can feel comfortable asking questions. The third thing we really focus on is helping them to identify their own emotions and learning ways to cope with them. We do that by using different games, activities, crafts, that kind of thing, as means to get them to talk with each other and learn.
This is a question for Sharon regarding vitamin D levels. So we know the importance of vitamin D in preventing cancer, but can you comment on how much is too much?
How much what?
How much is too much when taking vitamin D?
You need to get your level checked, and you want your level between 40 and 100. And if it's below 40, we recommend that patients take 8,000 IUs of vitamin D3 a day for 8 weeks, which is a really high dose. And then you get your levels rechecked in 8 weeks. It's really important if you're dosing yourself on vitamin D that you're getting your levels rechecked. A maintenance dose, once you're within the level of 40 to 100, would be 1,000 to 2,000 IUs a day. And so once your levels are within normal limits, you can get tested annually.
And what are some of the reasons that could prevent your levels going up in spite of taking supplements?
I'm sorry, say that again?
In spite of taking supplements for vitamin D, what are some of the reasons that could prevent your levels going back up to where they should be?
What causes levels to be low? Is that what you're asking?
What causes the prevention of absorption of vitamin D in spite of taking supplements?
Oh, there can be a lot of challenges. It can be related to your liver. It can also be, and I still want to make sure I understand the question. You're taking supplements and your levels are still low? That's okay. It could be based on the dosing. I mean, I don't know how much you're taking. It could be a combination of other medications that you're taking that could interfere with that mechanism. I guess I'd have to know the history to be able to fully answer that.
Can't you just go out on your sun deck and absorb a lot of vitamin D?
Well, you can. Some people can, but not everyone can.